This is Amber, 12 years old, coming in from Camp Oakwood. This is her counselor, Nicole. Ready? 1, 2, 3. Amber was riding a horse and was ejected across the top of the horse in front of a jump. She hit the crossbar of the jump with her head, landed on her stomach on the dirt. She's been awake and alert. She was wearing a helmet, but she does have some disorientation and was unable to touch her nose on the scene. She vomited twice on scene prior to our arrival and still has some nausea. The patient complains of a headache. She raised a pain of 5 on a scale of 1 to 10. No allergies and no meds.
Okay, did she lose consciousness at all during this time?
Nicole said she did appear to be unconscious immediately after impact.
But she rolled over on her own maybe 20 seconds after she hit.
Okay, thank you.
All right, good luck.
Can you see the figures?
Amber, my name is Dr. Andrea Grayson. Can you tell me what happened today?
I was riding and I fell.
Okay, she still seems a little disoriented. Can you tell me, was she thrown off the horse or did she fall off the horse?
Oh no, she was thrown off.
Okay. And was she dizzy or behaving abnormally before the accident?
No, she was fine. She loved riding. The horse just threw her.
Okay, so we can probably rule out the fact that she was under the influence of anything that might have caused her fall, but we'll run some tests to be sure. It looks like her disoriented state has been solely caused by the blow to the head.
Okay, her pupils are at 4 millimeters, they're equal round, reactive to light and accommodation. Her heart and lungs are clear, and she's got no lacerations.
Her abdomen is stiff, and we've got some hypoactive bowel sounds. She was guarding a little bit in her abdomen area when I examined her.
Okay, ready? 1, 2, 3.
Okay. So her pupils are behaving normally, which tells me she doesn't have any cranial nerve damage. She's moving her arms and legs, which is a good sign, no paralysis. With a stiff abdomen like that, along with the guarding, bowel sounds, and nausea and vomiting, we may have some internal problems from the impact of the fall. I want to get a rapid ultrasound and CT scan to test her abdomen. Also, when she's down at CT, let's get an image scan of her head and neck to rule out any nerve damage or brain bleeding.
It's gonna be okay, Amber.
Okay, let's go.
My stomach hurts.
No, we're going to take care of it, okay?
Amber, I reviewed the results of your CT scan. Thanks to that helmet you were wearing, it looks like our hypothesis was correct. And you're not going to have any lasting damage to your head, neck, or spine, just a mild concussion. But it appears that the force of the impact did cause a rupture in your bowel, which is where the pain is coming from in your stomach. We're going to take you into surgery and get that taken care of, okay?
Everything's gonna be just fine, Amber. Okay.
While you're in surgery, I'm also going to take a closer look at the rest of your internal organs and make sure that there are no other injuries. I'm pretty sure that we've identified the problem and we're ready to take action to treat it.
Okay. Hey there, Amber. How you doing, kiddo? Hi.
Amber, Nicole and I spoke with your mom and dad, and they're on their way here. You are very smart to be wearing that helmet. You won't have any permanent damage, but I do want to explain this concussion to you. This injury happens with a rapid movement and a sudden impact. Your brain is surrounded by fluid, so when it gets going really fast or your head gets hit, your brain just can't stop. So the brain hits the skull and gets bruised, and that's your concussion. You'll be kind of drowsy and disoriented for a few days, but that'll wear off.
And doctor, what about our stomach?
Well, with that sudden impact, your intestines didn't have a helmet or your skull to protect them. So the force of your fall made a small tear that we patched up with a few stitches. As I suspected, you didn't have any other internal injuries. Now you're going to be on some pretty powerful antibiotic medicine for a few days to fight off infection.
But she will be okay.
Amber, you're going to be just fine. I want you to take it really easy for about a week, and then you'll be feeling more like your normal self. You were really brave, Amber.
Thank you.
Yes, thank you, doctor.
You're welcome.